Welcome, my friends, to the Bob and Brad podcast produced by Bob and Brad, the two most famous physical therapists on the internet. My guest today is Dr. Ben Thompson, and he is going to speak to us about tinnitus or tinnitus, and we're going to get all the answers that you need. Welcome to the show, Dr. Ben Thompson.
Glad to be here.
Yeah.
Glad to be here, Bob. I've been following you for a while. I'm so glad to be a part of the Bob and Brad show.
Well, we're super excited to have you because we have many people inquire about tinnitus. So a great topic. I mean, really, a lot of people are suffering from it. So can you first give us your backstory, a little background?
Absolutely. My name is Dr. Ben Thompson. I'm an audiologist based in Northern California. I initially became interested in sound and hearing with my personal love of music and hearing protection and understanding how sound, which we love, can also damage our hearing and lead to adverse medical conditions. I completed my graduate program, Doctor of Audiology and Audiology residency in San Francisco at University of California, UCSF. At that place, what I learned at the university hospital was that tinnitus, also pronounced tinnitus, is a very underserved condition, and it affects millions of people. The treatments, the management strategies, the solutions do require expertise, and I was fortunate enough to build up that expertise, eventually starting a YouTube channel, educational information for tinnitus and hearing loss, and then eventually starting a company, Treble Health, which provides online telehealth services for those conditions.
And that's your website too, right?
That's correct.
Treble
Yes,
Health.
Treble Health is our company. That's how we help people with tinnitus.
And your YouTube channel is Treble Health, right?
That's correct. Yes, a young YouTube channel compared to your tried and true long time Bob and Brad.
Unfortunately, we've been a long time. Yeah. So we've got questions from our followers on Facebook, and then we got ours. So we got a lot of questions. The first question is there a cure?
Tinnitus, is there a cure? The short answer is no, there is no cure. And I want to bring an important point here is that many medical conditions do not have a cure. Let's make that clear. Anxiety, stress, cancer, those are common examples of things that affect millions of people, don't have a cure, can often be managed, and people go on to live healthy, happy lives. So the leading research into tinnitus is looking at things like restoring the cells of the hearing organ that may be contributing to the tinnitus. Other types of tinnitus research looks at the neurological brain and certain neurotransmitters, certain changes to the chemistry of the brain, and how that may reduce tinnitus. I will say that in my lifetime, I'm hopeful that there are medications or procedures that can significantly reduce some types of tinnitus. My prediction will be there will not be a all-for-one tinnitus cure, pop the pill, take the surgery, do a procedure, because there's so many different subtypes and causes.
Gotcha. Maybe Elon Musk with his Neuralink will come up with an idea. So I'm going to start with some YouTubers. One claims she improves her tinnitus by tugging on her ear. What?
Yes. So tugging on the ear, what does that do? Well, if I open the jaw and I tug on the ear, I'm moving two different parts of the anatomy, the ear canal, as well as the eustachian tube. So the eustachian tube is the tube that allows us to equalize our ears when we're flying in a plane or diving underwater in a pool. Blowing out, we equalize the pressure behind the eardrum. If someone has pressure, inflammation, allergy, they may have some tinnitus that's linked to their eustachian tube or that area around the eardrum. So in that case, that would be the only reason why tugging on the ear is going to be associated with improving or changing tinnitus.
Gotcha. Makes sense. So another YouTuber cited a modified version of a tapping technique where they tap on the back of the head by Jan Stridham.
Yes, I'm familiar with this tapping technique. I've listened to the technique. I've looked at the comments. One thing that's important for any doctor, for any medical specialist, but especially in something that there's not a hard and fast cure, that there's multiple different perspectives and different ways to manage it, is to have an open mind.
Sure.
Many times as a doctor, as an audiologist, I don't know. And I'm proud to say that, but I am willing to look into the possibility that it could be. So for this specific technique, which I do not recommend, by the way, is you put your fingers behind your ears and you're tapping on the bone behind your ears, which is called the mastoid bone. So you might look at the comments on YouTube and say, "Oh my God, this is helping so many people."
That's what it looked like.
And
Right.
I did it myself. It didn't change my tinnitus. I asked our community people in the comments. I made a review of it on YouTube myself. The short answer is that it can temporarily change the perception of tinnitus for no longer than a minute. And therefore it is associated with temporary relief, but functionally that doesn't do you something that if you work at every day, it's going to change your baseline level.
Sure. Is it a bit of a placebo effect, do you think?
It could be a bit of a placebo effect, as well as that bone behind the ear is exactly where the hearing organ sits.
Gotcha.
So sudden changes to the hearing system can change the perception of tinnitus. And remember, yes, like we had mentioned, that this could be partly a placebo effect because tinnitus is linked to our psychology, to the fight or flight mechanism that's analyzing everything and categorizing it as, is this something important or is this neutral? And if there is an association of this could get better, hence a placebo effect, then in the short term, it could lead to that effect. So you don't need to try that, but if you wanted to, there's no negative side effects.
Gotcha. So do hearing aids help?
Good question. There's two major types of tinnitus. One is your hearing in the normal range, meaning you got a hearing test and it showed normal hearing and you still have this bothersome tinnitus? And that's actually, I have normal hearing. My tinnitus is not bothersome most of the time. However, I have normal hearing. If I look really specific with certain tests, it shows my hearing is not what it used to be 10 years ago because I've gone to a lot of concerts, I've been around a lot of noise, etc. But still, I'm in that category of overall healthy hearing. I have tinnitus. The other group would be there's a hearing loss documented through a hearing test reviewed by an audiologist, and there's tinnitus. Both groups can have success with treatment of tinnitus through the use of devices on the ears. So for those who have hearing loss, hearing aids that are programmed for tinnitus by a tinnitus specialized audiologist can be set up to help retrain the brain and defocus from that sound. And over time, it helps promote this natural ability for your brain to reduce tinnitus over time. What that means is that hearing aids for those who have hearing loss are some of the best treatments and definitely in the top 3 of things you should try if you're having bothersome tinnitus and you have hearing loss.
Is that something you can do online or not?
That is something we do online, and we're proud to say that we have relationships with the best hearing aid manufacturers. It's amazing how the technology has advanced over the years because we're able to send devices, medical grade hearing aids to your house and connect them through your smartphone with an expert audiologist to program and change the settings based on your hearing test and send them through your phone so that you can hear well your tinnitus and hearing. And also you can make adjustments through the phone, and remote programming and remote fitting of hearing aids is possible and very successful in 2022. It's amazing.
Amazing. Yes.
One quick follow-up on the last comment is that even those who have hearing in the normal range can benefit from what's called tinnitus maskers, which are hearing aids that are programmed not for hearing loss because you don't have any, but for tinnitus, what's called sound therapy, which is white noise, pink noise, low level sounds consistently worn over a matter of months can help reduce tinnitus too.
What kind of things make tinnitus worse and what things make it better?
Great question. What makes it worse is, anything that activates the fear, anxiety centers of the psychology. Definitely, we know that can make tinnitus worse. And why is that? Well, the brain is designed to keep us alive, and the brain will make us focus on certain conditions, certain stimulus that are associated with a threat or threatening us. Therefore, when tinnitus is categorized by the brain as negative, harmful, bad, scary, fearful, then it usually keeps the intensity of the symptom high. So what makes it worse? It definitely anything that can affect the psychological system.
Sure.
Additionally, very loud noise can make tinnitus worse. Changes to your hearing or a medical condition that affects your hearing will make tinnitus worse. Stress often makes tinnitus worse, and insomnia often makes tinnitus worse as well. So it's really one of those symptoms that is getting it's relative to the health and state of the central nervous system. Yeah.
So when you treat people online, do you take into account stress? I mean, do you try to help manage it?
Absolutely. Managing stress as well as detailed information on tinnitus,
Helps
the
in
connection
itself,
between the
right?
brain. You're taking away those anxieties, fears with high quality information. I had a patient describe to me, they said, Dr. Ben, managing this loud tinnitus, it's really hard. I wouldn't wish it on anyone, but having a guide along the way,
Right.
just so I know what to expect, makes it a lot easier. And that's definitely partly what we do. To answer your second question of what makes it better,
Right.
the two major things that make it better are one-on-one coaching about neuroplasticity, about cognitive behavioral techniques to reduce tinnitus, getting out of those negative thinking loops, getting out of those traps of fear, anxiety, tinnitus, stress, insomnia. That's huge. A lot of the benefit will come from there, and that takes work. Additionally, personalized sound relief or devices on the ears that are programmed for tinnitus and the sound therapy. Those are either hearing aids or tinnitus maskers. We're able to do that all online and remotely now. It's really fascinating. The technology is excellent. If you do those two things, then that's about 80% of what can be done.
Nice.
Additionally, mindfulness, stress reduction, meditation, a holistic view, and check in on your stress. That is a big part of it. So all that to say, there are real ways to improve tinnitus, and doesn't happen overnight, but it really changes people's lives, and that's what keeps us coming back to the work that we do.
Yeah, it's, like you said before, this is just like our handling of chronic pain.
Tell me more. Tell me more about that.
Well, I mean, it's the same thing. We want that when they realize what it is, your nerves might be firing off. There's really no damage there. It's your brain that took over and is presenting with pain.
Mm. What are the common areas of chronic pain? Where does that manifest in the body?
It could be back pain. It could be neck pain. It could be anywhere. Yeah.
Yeah.
It often starts with something that was there, and then after a while, the brain took over. So.
Yeah, very similar, very parallel, and I'm glad we can have that.
Yeah.
Have that conversation. Yeah.
So does acupuncture help at all?
Acupuncture has been studied for tinnitus. It has not shown a clinically significant benefit. However, it has been around for thousands of years. And I don't know about you, Bob, but something that's been around so long that is adopted by many generations definitely has benefit. Now, whether it's impacting tinnitus directly, that's up for debate. And I would say probably not. But through these indirect pathways of stress, anxiety, the central nervous system, if any of those areas improve even marginally, then you may notice an improvement in your tinnitus. So for that reason, it's possible, but not medically recommended as a standard treatment.
So with your treatments, how much of it is any covered by insurance?
Hearing aids are partially covered by some insurances, and more than 50% of the hearing aids or medical devices that are on the ears for hearing loss or tinnitus are not covered by insurance. The one-on-one services that we have at Treble Health, those are not covered by insurance. Tinnitus has fallen for so many years in this mysterious category of healthcare where
Sure.
ENT doctors don't necessarily know what to do with people who have bothersome tinnitus. A lot of audiologists are not specialists in tinnitus. And there's so much overlap with psychology, anxiety, stress management that it creates a very unique individual patient journey that we've been focusing on. I hope in my lifetime and over the next years to come that tinnitus, that we can prove getting this care for tinnitus and having insurances pay for it actually saves them money in the long run because it's helping them with their outcomes and their quality of life.
Do you have a sense of how many people get better with your treatment? I mean, percentage wise?
Yeah, 85% of patients who follow that system, the tinnitus retraining model of the one-on-one coaching plus the personalized sound relief and sound therapy, get better. The average time frame it takes is between 6 and 18 months.
Gotcha.
Usually by 6 months, things are a lot better. By 12 months, things are almost there. And there is this period of more rapid improvement and then this longer tail of still working on it, still getting some marginal benefits over months.
So I take it that earbuds are not covered by insurance either, right?
When you say earbuds, do you
mean noise?
Hearing aids?
I mean, not hearing aids, but that provide the sound, that white noise.
So yeah, it's really important. I'm glad you brought this up. In my hands, I have some examples of some headphones. Yeah, some Apple headphones and some regular Sony headphones. Those are not recommended for following the sound therapy protocols because they block or occlude your ear canals. So anyone who's listening or watching from home right now, if you put your fingers in your ears or headphones in your ears, you'll notice you can't hear the ambient sound as well. Your own voice changes cadence and it changes how your brain's perceiving sound. You will reduce tinnitus better. You will habituate to tinnitus and improve better if you're able to hear the ambient sound simultaneously hearing the white noise or the pink noise as well. So for example, hearing aids that are programmed for tinnitus, the medical devices, they do not block the ear canals. Even though they go in the ears, they have holes and natural venting. So you're hearing all the ambient sound the same and you're getting the sound therapy. Very important distinction, and we're really getting into the details here. I encourage anyone who has more individual questions to reach out to an audiologist that specializes in this. Yeah.
And they could also ask questions, I'm sure, on your website, right?
Yeah, that's correct. That's correct. Our website's a great place to go if you want more free materials, my YouTube channel, our website. If you want a consultation, if you want a consultation with a tinnitus expert, then you can go over to Treble Health and we'll do our very best to serve you.
So are there any dietary or supplement approaches?
I'm happy to share that I reviewed the top 5 supplements that are sold on Amazon for tinnitus.
Right.
And it is noted that there is no FDA approved herbal supplement for tinnitus. And I'm sure you've come across this in your field that the FDA considers herbal supplements a food, meaning they don't monitor the marketing or the claims, which maybe I understand because it would cost them a lot of money, but it's pretty sad because there's millions of dollars spent a year on these false promises that certain herbal supplements will reduce your tinnitus. Well, you're not lacking a vitamin or an herbal component. That's not the cause of your tinnitus. So to think that an herbal supplement would drastically change things is hopeful. And unfortunately, those herbal supplements are misleading. I personally reviewed them. There's light evidence to suggest that certain components can be used in an overall tinnitus management plan. But please, if you're listening or know a loved one who is going through challenging tinnitus, don't make that your primary approach. Sure, it can be a secondary or an alternative addition, but really focus on the fundamentals. that work for most people. And then from there, you can try these alternative approaches.
Sound advice. So are there some natural ways to manage tinnitus?
Yeah, natural ways to manage tinnitus: stress reduction, mindfulness. Those are the first two that come to mind. Previously, we had spoken about the power of the brain and the nervous system to heal or to improve. And if we can take an 8 out of 10 level pain and bring it to a 3 out of 10, usually for most people, they say, all right, this is good enough. I can manage this. Same thing with tinnitus. If we can bring a 7 out of 10 tinnitus down to a 2 out of 10 tinnitus, that's a success, and that should be celebrated. Right. It's a big success, and it does take time. So, give yourself time, be patient, takes work. The natural stress reduction, mindfulness, that's a huge window of opportunity for most people. Additionally, working with a one-on-one coach or a therapist who's specialized in tinnitus, you could argue that's a natural form of improving it because you're only using your own brain.
Sure.
Yeah,
makes sense. So we talked about supplements, but do any of the over-the-counter pills work? I think I know the answer to this.
No, unfortunately, there is no pill that independently reduces tinnitus. Depending on the cause or subtype of your tinnitus, there may be certain medications or pills that reduce the symptom temporarily. But again, that should not be a primary approach for this.
Sure. Did we cover everything that you do? I mean, do we know what?
Yeah, what we do is we have a team of tinnitus specialized audiologists. And I believe the audiologist is the best suited professional to help someone through this entire tinnitus journey. What I found when I was working in San Francisco in a residency at UCSF hospital, we had a patient who had bothersome tinnitus who drove 4 hours from Lake Tahoe all the way to San Francisco to see me, and I was doing the appointment. So they had already been to local doctors.
Sure.
Still, they knew there must be something more. So they came 4 hours. And at that point, I realized that most of what we were doing was having conversation and counseling and consultation, discussion, right? Education, and some sound therapy and some medical devices too. But most of it could be done online via telehealth. So that was the original inspiration and spark where I realized let's combine technology with these individuals who are all over the country and world who need help.
Right.
And that eventually started the telehealth company, which is now Treble Health. And we have a growing team of 7 in-house audiologists who are focused on tinnitus. And it is a challenging problem to work on. However, when we can take someone from that challenging point into a resolved state, they're so thankful. And when those success stories are reminded to our team, we just light up with joy, because that's what we're doing, really impacting people's mental health and quality of life.
I'm curious, do you see people for hearing loss too?
We do.
Just pure hearing loss?
We do, yes. Mm-hmm. We work with the major hearing aid manufacturers, and we're able to program remotely and ship hearing aids to your house, program them remotely with an expert audiologist. And that's been very successful for patients, for individuals who are having trouble with understanding speech and background noise, hearing things clearly, hearing family members clearly. Then hearing aids absolutely help and definitely should be considered.
All right, I guess this is the final question. Is there any meaningful research being conducted to find a cure?
Yes, there is. There has been significant research in tinnitus over the last decades. And think about this. The United States military veterans, the number one service-connected disability is tinnitus.
It is. Makes sense.
There is a huge, that means that the government is paying, disability to many, many veterans for tinnitus. So there's a high degree of incentive for the government to find a cure and solution for tinnitus. Unfortunately, over the years, there has not been something that works. There's been research, there's been testing, the newest treatment, something that we're following here as it becomes FDA approved in the United States, is something called bimodal stimulation. And it's a type of tinnitus treatment that you can pursue and ask a tinnitus specialized audiologist about. The second and other research into cures are focused on the auditory hearing organ, the cochlea, and restoring some of those hair cells. That's also been worked at for decades and very tough problems to solve. And then finally, there's other investigations into changing the brain connections, changing the way that the brain neurons or the cells and the chemicals between them operate, and if that can reduce the tinnitus coming from the brain. So I'm following it. If anyone still wants to learn more, I do updates on my YouTube channel about the research as well.
Gotcha. Is there a device for that bimodal stimulation?
There is, yeah, and it's a non-invasive device.
Really?
There's some different forms of how it's presented on the body. One modality, one company is using tongue stimulation. The other company which is in development, is using
you say tongue?
Tongue, yes.
Oh, wow.
Connecting to nerve in the tongue, and another company is using the cheek and the neck. So nothing to jump out of your seat right now in the middle of 2022, but we anticipate towards the end of the year, if you reach out to us at Treble Health or follow me on YouTube, for example, we can give up-to-date information on those treatments and how they can be used in a comprehensive plan.
Well, Dr. Thompson, this has been a real pleasure. I'm sure we're going to help thousands of people. I mean, they'll have at least some guidance of where to go.
Absolutely. And that's our goal, is to provide information, education. We want to give as much free away as possible. Of course, there's always a benefit to having a one-on-one consultation or getting medical devices. And if anyone who's listening knows someone who needs help with those, you can find us at treblehealth.com.
Thank you very much for being on the show.
I appreciate it, Bob.
Have a good day.
Take care.